Phlebotomy exam questions and answers 2026. Question 1. Hemoconcentration of the specimen can be avoided by cleansing the site properly, applying the tourniquet loosely, removing the tourniquet within 1 minute, applying the tourniquet tightly. Prolonged tourniquet application, 1 minute, causes localized hemoconcentration by increasing venous pressure and forcing plasma out of the vein. The tourniquet should be released as soon as blood flow is established or within 60 seconds to prevent falsely elevated levels of proteins, potassium, and other analytes. Question 2. How long should a tourniquet be placed around a patient's arm? No more than 1 minute. Approximately 4 minutes. Until the needle is removed. Until the entire puncture is complete. The tourniquet should remain on the arm for no more than 60 seconds. Prolonged application causes hemoconcentration, patient discomfort, and potential nerve damage or petechiae. The tourniquet should be released as soon as blood flow is established or within 1 minute, whichever comes first. Question 3. To avoid contamination, when should the needle cap be removed? When setting up the equipment. Upon finding the venipuncture site. Just prior to performing the puncture. When applying the tourniquet. The needle cap should be removed immediately before performing the venipuncture to prevent contamination of the sterile needle. Removing the cap too early exposes the needle to environmental contaminants and increases risk of accidental needle stick. After removal, the cap should not be replaced. Recapping is prohibited by OSHA. Question 4. Which of the following may cause hematoma formation? Removing the tourniquet before the needle. Bending the arm immediately after bleeding has stopped. Firmly anchoring the vein during needle insertion. Having the patient bend their elbow to apply pressure. Having the patient bend their elbow to apply pressure, rather than using straight arm pressure, can cause the vein to move and the puncture site to stretch, disrupting clot formation. Proper pressure application should be with the arm extended, using the opposite hand to hold gauze directly over the puncture site for 3 to 5 minutes. Question 5. If serum is left to remain on the blood clot for more than 1 hour, which of the following most likely will occur? Serum glucose levels will increase. Serum glucose levels will decrease. Serum potassium levels will increase. Serum potassium levels will decrease. When serum is left in contact with the blood clot for extended periods, red blood cells continue to metabolize glucose through glycolysis, consuming glucose and decreasing its concentration in the serum. This can cause falsely low glucose results. Additionally, potassium may leak from cells, falsely elevating levels. Question 6. Complete clot formation of a blood specimen can take up to 10 minutes at room temperature, 30 minutes at room temperature, 30 minutes at refrigeration temperature, 2 hours at room temperature. Blood collected in tubes without anticoagulant typically takes 30 to 60 minutes to clot completely at room temperature. Clotting involves a complex cascade of coagulation factors that requires optimal temperature. Centrifuging before the clot is fully formed can result in fibrin strands in the serum, which may clog analyzers and produce inaccurate results. Question 7. When a patient develops syncope during a venipuncture, the phlebotomist should first lower the patient's head, remove the tourniquet and needle and call for help. Complete venipuncture as soon as possible. Have the patient stand up. Syncope, fainting, during venipuncture requires immediate removal of the tourniquet and needle to prevent injury and restore normal circulation. The phlebotomist should then call for help while ensuring the patient does not fall. The venipuncture should never be completed while the patient is fainting, as sudden movement could cause needle-related injury. Question 8. A collapsed vein will cause a sensation of blood flow, greater flow of blood, patient to faint, vein thrombosis. When a vein collapses during venipuncture, the phlebotomist may experience a sensation of blood flow stopping or reduced resistance during syringe draw. This occurs because the vein walls adhere to each other due to excessive vacuum pressure. Using a smaller gauge needle, releasing tourniquet pressure, or using a syringe with controlled draw can help prevent vein collapse. Question 9. The phlebotomist places the blood specimen in circles on special filter paper for what test? Cholesterol, bilirubin, CBC, PKU. PKU, phenylketonuria, screening requires blood spot collection on special filter paper, Guthrie card, a newborn screening test that detects elevated phenylalanine levels, indicating PKU, a genetic disorder that causes intellectual disability if untreated. Blood is collected by heel stick and applied to pre-printed circles on the filter paper, which must saturate through completely and be air-dried before transport. Question 10. Pre-analytical errors are mistakes made only by the phlebotomist. Before laboratory testing, during laboratory testing, after laboratory testing. Pre-analytical errors occur before the specimen reaches the laboratory, during patient preparation, specimen collection, handling, transport, and processing. These errors account for up to 70% of all laboratory mistakes and include misidentification, incorrect tube selection, improper mixing, hemolysis, clotting, inadequate volume, and transport delays. Question 11. Which of the following is proper care of the patient following collection of an arterial blood specimen? Have the patient apply pressure immediately. Ask the patient to check the site after 3 minutes. Apply firm pressure for a minimum of 3 to 5 minutes. Request patient apply pressure until a nurse checks. Arterial puncture carries higher bleeding risk than venipuncture because arterial pressure is higher. Following arterial blood gas collection, firm pressure must be applied for a minimum of 3 to 5 minutes, or longer for patients on anticoagulants. Failure to apply adequate pressure can result in significant hematoma formation or pseudoaneurysm. Question 12. The term calcaneus refers to an abnormal reaction of vessel walls that stops blood flow, an infection of the blood, the heel bone of the foot, the sole of the foot. The calcaneus is the heel bone, the largest bone in the foot. It is an important anatomical landmark for phlebotomists performing infant heel sticks because the puncture site must avoid this bone to prevent osteomyelitis, bone infection, or injury. The recommended puncture sites are the medial and lateral plantar surfaces, away from the calcaneus. Question 13. Heparinized plasma is preferred over serum for some chemistry tests. Heparin prevents clotting by binding calcium, inactivating thrombin, preventing glycolysis. None. Plasma requires blood to clot. Heparin prevents clotting by activating antithrombin 3, which inactivates thrombin and other coagulation factors, thereby inhibiting the clotting cascade. Unlike EDTA and citrate, which work by binding calcium, heparin does not significantly alter electrolyte levels, making it suitable for many chemistry tests. Question 14. Which of the following anticoagulants is found in a green-topped blood collection vacuum tube? EDTA, sodium citrate, sodium heparin, ammonium oxalate. Green top tubes contain heparin, sodium heparin, lithium heparin, or ammonium heparin, as the anticoagulant. Heparin activates antithrombin 3, which inhibits thrombin and other clotting factors. These tubes are used for chemistry tests when plasma is preferred over serum. Lithium heparin is most common because lithium does not interfere with most chemistry assays. Question 15. The most critical part of a blood culture collection is filling the 2 media vials adequately, skin antisepsis of the collection site, selection of the collection site, timing of the second set of cultures. Skin antisepsis is the most critical step in blood culture collection because contamination with skin flora is the leading cause of false positive blood cultures. The site must be cleaned thoroughly with chlorhexidine gluconate or iodine, allowed to air dry completely, and not repalpated after cleaning. Contaminated cultures lead to unnecessary antibiotic treatment and extended hospital stays. Question 16. A blood sample is needed from a dialysis patient. Which of the following is an acceptable procedure? Draw from the vein with a cannula. Draw from the vein with a fistula. Draw from a hand vein. Either A or B would be acceptable. For dialysis patients, blood should never be drawn from the arm with an arteriovenous AV, fistula or graft, as this could damage the vascular access site or cause clotting. Blood should be drawn from the opposite arm, hand veins, or other peripheral sites. Drawing from a vascular access site requires special permission and should only be done by trained dialysis personnel. Question 17. Specimens are scheduled for collection at specific times for different reasons. Which of the following is most likely not a factor? Measuring the body's metabolism of the test substance. The substance exhibits diurnal variation. Patients must be tested 2 hours before meals. To determine blood levels of medications prior to next dose. Timed specimens are collected for specific clinical reasons: to assess metabolism, glucose tolerance test, to account for diurnal variation, cortisol levels peak in early morning, and to measure trough levels, lowest drug concentration before next dose. 2 hours before meals is not a standard timed collection parameter. Question 18. The anticoagulant heparin is used in tubes with stoppers of what color? Light blue, lavender, green, red. Green top tubes contain heparin as the anticoagulant. Lithium heparin, most common, is used for chemistry testing because lithium does not interfere with most assays. Heparin works by activating antithrombin 3, which inactivates thrombin, preventing clot formation. Green top tubes should be gently inverted 8 to 10 times immediately after collection. Question 19. The most common antiseptic for routine blood collection is povidone iodine, 70% isopropyl alcohol, 5.25% sodium hypochlorite, antibacterial soap and water. 70% isopropyl alcohol is the standard antiseptic for routine venipuncture because it effectively reduces skin bacteria, dries quickly, approximately 30 seconds, and does not leave residue that could interfere with test results. Stronger antiseptics like iodine or chlorhexidine are reserved for blood cultures or patients with known infections. Question 20. When performing a heel puncture on an infant, proper technique includes having the parent or guardian hold the infant's foot, firmly holding the puncture device in place until blood appears, placing the lancet flat against the skin on the medial or lateral plantar surface, not discarding the puncture device until blood appears. The lancet should be placed flat against the skin on the medial or lateral plantar surfaces of the infant's heel to achieve proper puncture depth, 2.0 mm or less. The puncture should be a quick, decisive motion. Holding the device in place is unnecessary. The puncture device should be used once and immediately discarded in a sharps container.